Our main finding in this study is that the Medtronic in-PACT Admiral paclitaxel drug-coated balloon performed quite well in the challenging anatomy of in-stent restenosis within the femoropopliteal artery segment. Our main outcome of target lesion revascularization showed good results out at 12 and 24 months. Probably the biggest pro of so-called real-world evidence or real-world data is it isn't, in fact, obtained from which essentially is everyday practice. So that includes a variety of practitioners working to care for a variety of patient populations, as opposed to the sometimes restrictive inclusion and exclusion criteria of clinical trials. Well, I think the power of it, there's power in numbers. Several hundred thousand, procedures recorded over the past decade or more within the registry, and it continues to accrue, tens of thousands of patients annually. So that's a rich repository of information that studies like this may not be able to be accomplished, outside of a registry framework like this. I can just speak to the pros of the VQI, not necessarily the negatives of others. One thing I like to highlight is recently there's been a merger between the NCDR, the ACC peripheral registry, and the SVS VQI. So I think that that collaborative nature of those two organizations bears fruit within the VQI. As difficult as it is, we work towards 1 year and later outcomes, and we continue to refine our abilities to track late outcome, which is so crucial in a chronic condition like PAD. So those are probably the two main things I'd highlight are the multispecialty nature of the registry, including vascular surgeons, cardiologists, radiologists, and our continued effort towards gathering the best longitudinal data on our procedures for our patients. We're looking to track the results out to 3 years. So that's our next step, and we expect those findings to be reported back to the investigators, to the sponsor, and to our FDA regulators in the early part of the summer of 2023, and look forward to bringing those results to the vascular community following that.